the bottom, the chat feature which is at the bottom of the screen. And one thing we would ask is please do not share any personal medical questions on the chat because anything you write can be seen by everyone. If you do have a medical question, please reach out to your doctor directly after the call today. We are covering a lot of information that will also be shared with all of our patients at Mass General because it is important to know regardless of our age. We are so grateful for all the questions you sent us, and if we don't have time to answer all of them, we plan to send out more information after the call. We have great speakers today, and we have a lot of them. So I hope you don't think I'm rude if I step in and cut someone off after about 5 or 6 minutes so that we can leave time for your questions. I'm going to introduce everyone now, so let's get started. And in order, today you will hear from Dr. Sharon Levine, Dr. Christine Ricci, Dr. Juliet Jacobson, Miss Emily Sterling Graves, and Dr. Matt Russell. And all of our speakers today are members of the Mass General Division of Palliative Care and Geriatrics. And so with that, let's get started. So Dr. Levine.
Hi, everybody. Welcome, and so happy to have you all here. So the first thing I'm going to answer is, what is COVID-19? It's an absolutely new disease caused by a new virus that has not been seen before in humans. There have been other coronaviruses, and a lot of them cause the common cold. This is not that virus, and it's spread from human to human. It's incredibly contagious, as we know, because it's now present in 184 countries around the world, and it's a pandemic. So I think this may be one of the most important things that I say is, how do you get it? And the evidence continues to support the vast majority of viral transmission is through large respiratory droplets that come out of your mouth and your nose when you cough and when you sneeze. And they land on you. If you cough on your hand, they land on your hand. If you're standing at your kitchen counter, they land on your counter. They don't go very far. This is not like spraying Lysol where it's all in the air. These are droplets. And anybody who touches those droplets can spread those to him or herself. So if there are droplets on a counter and then you touch your nose or you rub your eyes or you put something in your mouth, that's one of the ways that these get spread. I also want to say that this is why it is so important and why you keep seeing all of these videos about washing your hands for 20 seconds and singing happy birthday twice in a row, or wearing a mask, or using hand sanitizer. This is the most important thing you can do, and the other most important thing you can do is stand 6 feet away and have social distancing. That distance, the droplets can't make it that far, so that distance plus a mask that covers your nose and your mouth, not just your mouth or not just your nose, but your nose and your mouth is what you need to stop those droplets from coming out. So wash your hands, wash your hands, wash your hands. If people come in, if someone is coming in to give care, they probably should be wearing a mask. Wipe off surfaces with disinfectant wipes or soapy water. Doesn't seem to spread through food. Wash your hands after you go to the supermarket. I'll talk a little bit about what the symptoms are, because a lot of you are concerned about it. And that includes runny nose, new sore throat, new dry cough, new muscle aches, new fever, new loss of sense of smell or taste. Some people are very tired. And then there's a group of people who are considered high risk. And those are people who are older than 70 and have chronic lung disease, some of which may be severe, or congenital problems that cause lung disease, heart disease, including heart failure and sometimes angina, people who have an immune system that's not working because either they have a medical condition or because they're on medications that suppress their immune system as a treatment for disease. And people who come from long-term care facilities, you've seen all of this, the nursing homes in Washington and here everywhere in Massachusetts. My own mom is in one of these kinds of places too, and there's COVID there also. So what do you do if you think you have it? Call your primary care doctor. That's what we're here for. You'll be asked a lot of questions, and based on those questions, you'll be triaged appropriately. Watchful waiting, or having a schedule, with scheduled provider check-ins along the way. You may be referred to a respiratory illness clinic where you will get further screening, or if you were really ill, you might be sent to the emergency room. So I think that some people who are asymptomatic, and I didn't say this before, but I want to say it now because it's another major point I would like to make, is that there are asymptomatic carriers of COVID-19. They are completely asymptomatic, not a sniffle, not a cough, not a sneeze, and they can spread it to other people. And that's the other reason that everybody should be wearing masks. You protect yourself, but you protect others if you are an asymptomatic carrier. So there are people who are asymptomatic that might need to get tested if they need to return to work, and they need clearance from occupational health after if a patient is being moved from one facility to another, or if they have to have surgery. But the symptomatic testing is based on the symptoms that I talked about before, and that's really important. So there are patients, there is testing that will be available. It goes through, all of it goes through some form of screening. Some of you asked for drive-bys and things like that. And you can call your doctor, and if you're not a patient here, you can find out where those places are. And you may not be offered testing if people think that you are not symptomatic, but in which case, somebody just came to me the other day and had a stomach ache and was worried that this was COVID, but had no risk factors. And I was able to reassure that person who in fact had stomach problems before. So I think,
Dr. Levine?
yes,
It's
we're
about
done.
time to wrap up.
We're done. I'm done with all I had to say.
Thank you. Dr. Ricci?
Good afternoon, and we're so honored and grateful to be a part of your care. And we recognize that this is an unprecedented time for most of us. We've never lived through something quite like this before, and so that makes it very scary. And want you to know that Massachusetts General Hospital and Partners Healthcare are very, very committed to doing everything possible to support all of us. And they're doing a number of things in that mode. And one is that they have created something called an incident command structure, which is more of the kind of structure that one would experience perhaps in a military situation or during some sort of time of war, where a lot of decisions are being made in a top-down way, but also with attention to all the different coordination of efforts that have to occur across the entire health system. They've really helped us create and set up new respiratory illness clinics and testing stations around Boston. They've been working to help us create ways to follow up for folks who have been to those clinics. They've been looking at ways to support testing in places where there's a need for additional testing outside of those clinics. And they've also been working with us to do a lot of other initiatives to support our patients. One of those initiatives that the hospital has been working on is to support all of our primary care providers as best they are able, recognizing that some of them are actually being deployed to take care of patients in the hospital, but as best as they are able, that they and their practices are trying to reach out to patients to see how they're doing and how they're holding up. We also are encouraging people through outreach documents, including the one that you received as part of this town hall, to do everything you can possible to stop the spread in all the ways that Dr. Levine just mentioned, and also to plan ahead in case one of us or one of our loved ones gets sick. This is very important, and I have to say that this whole coronavirus has reminded me that I need to be doing that, and I've come up with my own plan should I get sick or one of my loved ones get sick. I refilled out, I have always had an advance directive, but I refilled it out because I wanted to make sure that I and my family members knew what was important to me. In addition to that, I want you to know that we are working very hard with our infection control specialists, who are some of the most well-recognized infection control specialists in the world, to make sure that we are staying as up to date on what kind of support and infection control measures we can take for our healthcare workers as we possibly can. And that's both inside the hospital and inside the home. So I want you to know that all of the folks who are providing care for you in the home that come from Massachusetts General Hospital or from Partners Home Health are given the latest infection control guidelines, and they are following them as close as possible. We are also working across all of the Partners Healthcare system to figure out how we can provide optimized care in the home, because there are a number of different pieces of care that requires, and doing everything possible to pull together all of our resources, all of our assets, to make sure that you get the care that you need in the home, should that become a need in the future. It is important to keep in mind that service availability does depend on the capacity of our partner programs, and that relates to whether or not some of those personnel are getting sick themselves and can no longer provide care, the availability of certain kinds of protective equipment. Happily, we're doing a great job in increasing our availability of protective equipment, so that's becoming less of a situation. But just, we want you to know that we are working very closely with all of our partners to optimize our ability to serve you and to serve you in the community. And I'll turn it over to Dr. Jacobson.
Great. Hi, everybody. I'm Juliet. And as Sharon and Christine have been saying, there are very important ways that you can protect yourself in this situation, and also important ways that you can begin to prepare. And I'm going to be talking about one of the most important ways that you can prepare, which is to think a little bit about what your priorities are and what might matter most to you if you did get sicker. And sometimes these types of situations are hard to think about. But what we find is that when people think ahead and have some sense of what matters most, they feel more in control of their health situation. Now, we know that people have lots of different priorities. Some priorities might be to spend time with family, to not be a burden, to be comfortable, to live as long as possible. And most people have more than one priority. And I would say you don't need to sort them all out. You don't have to know which is the most important, but it is helpful to have a sense of the gist of what the ones are that matter the most to you. And as you go through this process of reflection and of thinking about your health and your own values, we ask that you also include your family in that process. Families that understand each other's values and priorities feel much less stressed when faced with medical decision making. I just spoke the other day with the wife of a patient who had been very, very sick, and she had to make the decision to stop life support. And she told me she was so grateful to him that he was able to tell her his wishes so that she didn't feel the full weight of that decision making when it was her turn to help make those decisions. So we encourage you, even though it can feel hard and it can feel sad, to have some of those conversations with your family so they have a sense of what you would want. And even if you don't know and you just give them some flexibility to decide, that's actually really important so that people feel like they're not going to make the wrong decision. As you're talking with your family, we ask that you choose a medical decision maker if you haven't done that already. And there are forms in the health clinics that you can fill out. They're also online, so that you can choose a medical decision maker who knows your priorities and who's delegated to make those decisions. Sometimes families together make the decision, but they still have one spokesperson who might speak and be the liaison with the hospital. We're asking in this time of pandemic that you actually choose 2 medical decision makers just in case one of them is sick. And as you're having all these conversations, we encourage you to talk with your doctors about what your values and priorities are, so that they can know, and that so they can partner with you in the decision making, because it's often complex and we don't know it all ahead of time. We have to keep talking together to figure it out. And we know this is a process, that this doesn't happen just once, that this is a series of conversations that you've probably already started and now are revisiting again to rethink what matters most to you now. Thank you.
Miss Aronson. I'm sorry, Miss Sterling Graves.
Hi, everyone. So this time has been unsettling for all of us, leaving us feeling vulnerable in ways we might never have imagined. And as the social worker for senior health, I've had the opportunity recently to speak with many of you, and it's clear that this pandemic poses special challenges. You may live alone and may be choosing not to leave your home at all, but you have no family or friends to deliver food or supplies. You may be wondering who will be there to care for me if I become critically ill, or who will care for my spouse. Perhaps up until now you have been fine with some help from a home health aide or a homemaker, but you no longer feel safe having them come to your home, or they have stopped coming altogether. Some of our patients with dementia have managed at home with the help of day programs, but now they are closed, leading to a scramble for alternatives. So I would like to offer some reassurance that it's still possible to get the assistance that you need and that we can help you find it. Elder service and home care agencies are still taking referrals. Most cities and towns have organized volunteers during this pandemic that are willing to reach out and offer help, such as delivery of food and needed supplies. A good way to get in touch with these volunteers is to call the Town Council on Aging and leave a message. And based on my experience, they call back very quickly. But of course, we can also help you with that if you need. We also need to take care of our mental health while we cope with this tremendous amount of anxiety. And an article that I found helpful is entitled, "That Discomfort You Are Feeling is Grief." It summarizes an interview with grief expert David Kessler, who points out that in addition to anxiety, this is a time when we are experiencing significant grief. Grief because we are experiencing losses on many levels, loss of our routines, loss of our sense of safety around ordinary events, such as going to the grocery store, visits with family, even touching a doorknob. Many of you report feeling more isolated, having lost your daily outing to get coffee with a friend, or the sense of comfort you take from being greeted by your favorite cashier at the pharmacy. So what can we do about this? According to Kessler, simply being aware of our grief is a start. He urges us to work towards acceptance, saying that this is where our power lies. With acceptance, we can find control. We can wash our hands. We can keep a safe distance. We can call a friend to check in. Kessler also stresses the importance of staying in the present. We need to make an effort not to let our thoughts run away with us about everything that could happen. Now, of course, this is easier said than done. And if you're looking for some additional resources to help you with this, I recommend also looking on the MGH Department of Psychiatry website, where they have put up a mental health and COVID-19 guide, and they have some really useful links and ideas. And also, again, if you're finding this time particularly difficult and your normal sources of support are not enough, please do reach out. Please give us a call. And so this has been extremely difficult for all of us, and please take some comfort that you're in good company. And if you're a senior health patient with a new or pressing concern about this epidemic, please do give us a call. And if you're on this call because you're connected to the Dementia Caregiver Collaborative, you can please call them or your own primary care provider. And afterwards, if you want some of the links to these articles or the Mass General website, you can email Monique. She'll put up her email. And now I'm passing it to Dr. Russell.
Thank you, Emily. Good afternoon, everyone. I'm the medical director of the Senior Health Clinic. And as we've faced this unprecedented time, it's been a real effort for us to reach out to all of you and connect with you through these newfangled, for many of us, newfangled ways. So I'm delighted that we have over 160 participants on this call today. Just to let you know what we've done in the Senior Health Clinic, by now you should have been contacted by a member of our team, and in reaching out to you, we've sort of hopefully supplied you with some contact about how to get in touch with us if anything goes wrong. I want to assure you all too that we're not only taking care of you about the COVID thing, but about all your other health needs, because all the other things that happen to us, like, you know, falls, trouble breathing, coughs, sneezes, aches and pains, all that stuff still happens, and we're still available to answer those questions. So you're being offered, instead of an actual in-face visit, you're being offered a video visit like this, which we would do one-on-one, or a telephone call visit where we're able to address your needs. The goal is that by reaching out to you proactively during this time, not just about COVID, but about all of your other healthcare needs, is really to detect any slight problems that are starting to brew, rather than letting them get to a point at which you might need to leave your home and go to a hospital and potentially be exposed. So that's sort of what we're doing right now. And additionally, we're doing these outreach Zoom town hall meetings. I get the impression from the enormously thoughtful questions and the many questions that we have that this is not a one and done kind of thing, but that this is something as a practice we'll be offering for informational purposes to you during the time of this pandemic. Additionally, I just want to put a little question out. What more could senior health be doing for you? Because we're only one part of the equation. You're the other part. So if there are ways that we can be more supportive, help us to think about what that would look like and what you would need. So that's my request. And as always, it's just phenomenal to touch base with you in whatever way we can. So with that, I'll hand it back to Susan.
Thank you so much to all of our speakers. I'm going to now start responding to some of the questions that we got before today's call, and also that we're getting in the chat box. So there are several questions about how safe is it to go outside and walk in the halls if you live in a senior apartment? How safe is it to go outside and walk? So Dr. Russell, would you like to respond to those and what people can do to protect themselves?
Sure. I think actually Dr. Levine is going to answer that question because she's sent me a text.
Okay.
We're all using technology.
Dr. Levine.
So, hi, it's a great question, and it was on my list actually to talk to you about. Get exercise, get out. We're all cooped up. There's all my patients are going out. You just wear a mask. If you have to hold on to a railing when you go down the stairs or press elevator buttons to get down in a building, make sure to wash your hands when you come back in. And then walk, walk and just stay 6 feet away. I know it's hard, like parks. The Esplanade is probably very crowded now. City streets are crowded now. Parks are crowded, but you can find a way to keep your distance. And if you're wearing a mask, you are protecting yourself and you're also getting exercise. So I think exercise is, Emily was talking about what you can do for your spirits. getting out there and using your body and getting exercise is one of the great ways you get to fiber. It's good for your heart, it's good for your lungs, it's good for your spirits, it's good for your bones, it's good for everything. So definitely do that. Just wear a mask and wash your hands when you get back in.
Thank you. Another question that has come up, and I will stay with you, Dr. Levine, is if people want to check, what's the best way to find out if the practice has people's advanced directive information or healthcare proxy information?
So you can call us and we can see right in Epic if we had it. What I'm doing, and I think most of us are doing, is partly because of the kinds of things that Dr. Jacobson, Juliet Jacobson talked about, is we're going over those and making sure that that there have been no changes. And Christine Ritchie may want to talk about this some more, but we are really revisiting that. And it's in Epic, it's on a bar, but if somebody doesn't have that, ask your doctor to check. And if it's not listed anywhere in your chart, it's a really good time to sit down and have the conversations with the people who love you and who you love, so that we can get it right and have your wishes documented carefully. But we have all that. It's right in the banner of your chart if you've done it with us, and we can tell you. Epic is our chart, our electronic charting system.
Thank you. Another important question, and several questions have come in about, and I'm going to ask this of Dr. Ritchie, if people have home health aides or other independent care providers that are helping them in the home, should they be wearing protective equipment, masks? And if they don't have access to it, if they're an independent caregiver, how can they get that?
So as you all may know, much of what we thought early on with respect to this virus is changing. And I think we are all beginning to appreciate the real value of wearing covering over our face and nose, our mouth and nose, to prevent others from getting the virus if we unknowingly have it, or to prevent others from giving it to us if they unknowingly have it. So we would recommend that in general, people do wear face coverings. And as you may have heard, the Center for Disease Control just came out recently making that recommendation. And for most people, the face covering does not have to be a fancy, healthcare mask. In fact, it's probably best if it's not, so that those can be saved for people in the healthcare workforce. That being said, the good news is we're beginning to appreciate more and more how masks help, and that masks that are even sewn together can be quite valuable. Some of you who like to watch videos may enjoy the video put together by our Surgeon General, who used one of his old t-shirts to make a mask. This Center for Disease Control actually has many little guides for how to make masks, but I want to make one very important point here, which is covering your mouth and nose with anything is better than not covering it at all. And whenever you go out, I would strongly encourage you to do that. And then number two is, if you're going to make a mask, what the studies are now beginning to show is that tightly woven fabrics, like something like 100% cotton, and especially the high thread count cotton, is probably the best way to go in terms of making your own mask. And you want to use 2 layers. More is not necessarily better. If you put in like 5 or 6 layers, you may have very significant difficulty breathing. So 2 layers of a tightly woven cotton as your starting point for your mask, and then 2 pieces of some kind of elastic to secure it around your ears is probably the most important thing. And I would encourage all of us, no matter the age, that when we go outside, we're wearing covering over our mouths and noses. And as Dr. Levine stated, it's important that it covers both your mouth and nose. I've been humored by walking on the Charles River with my mask on to see people wearing masks but having it down under their chin, which does not really help them or help those around them. So please wear them over your mouth and your nose.
Thank you. I'm going to pose a question, and I'm not sure who is the best person to answer this, but it's an important question that I think many of us have. If you don't have a thermometer or antiseptic wipes or bleach or gloves, any suggestions about where these might be accessible now? I know a lot of the online places where people order from, they're no longer available, but does anyone, any of our speakers have any recommendations about where to get those if you don't currently have them?
Oh, it's not a guarantee, but you could also try in the same way that the councils on aging are organizing volunteers. They are also getting donations of supplies. It's not, they won't always have them, and you might want to check back. But if you contact your city hall or the town council on aging and leave a message, they often say even on the message whether or not they have some supplies like masks and so on. So another thing to try.
Thank you.
Mm-hmm.
I was just going to echo that is what we've heard from the Office of Elder Affairs, and so please reach out to them. They're working very hard to try to supply those, especially the sanitizing equipment, to people who need it.
Thank you. I'm going to go back to Dr. Russell and ask you to say a few words. We got several questions about testing. Who do we call if we are concerned or we think we've been exposed to COVID-19? Is age a factor in who gets tested? And what are the options around being evaluated? So Dr. Russell, could you maybe address some of those questions?
Absolutely. These are really phenomenal questions because we've spent a lot of time since the outbreak to really determine how best to help patients flow through the system based on the symptoms they may present. So the first and foremost touch point for this would be to reach out to your primary care doctor. All of our primary care sites are equipped with a patient triaging tool. And I don't mean triage in terms of battlefield. I mean triage in the sense of, does this person need to come in for a test, or can this person stay home? Many times patients who are asymptomatic but have been exposed are asking, should I get tested? And we're actually encouraging them not to. We're encouraging them to stay home unless they're going to be going into a healthcare facility and working in a healthcare facility. We're encouraging them to stay home, and our teams are generally then doing outreach on a regularly scheduled interval to make sure that the patient is either not developing symptoms, or if they are, how then we would triage the person at that point. So really, if you need, only asymptomatic people would only be tested if you needed to return to work in a healthcare facility, or if a loved one is being moved from one facility to another. So we're seeing this now in terms of patients leaving, say, the hospital and going to a rehab facility. The rehab facility is requiring testing for their infection control, even though that patient is asymptomatic. Symptomatic testing is really based on the symptoms that Dr. Levine addressed. In addition, in patients who are high risk. So these other additional populations that might get testing preferentially would be dialysis-dependent patients, patients who are homeless, if they're in the inpatient setting or emergency room and are presenting with these symptoms, or if you have a known exposure from a family member who might be a healthcare worker or a healthcare worker who's taking care of you. Similarly, people are asking about when will testing be available. Routine testing, just going into a drive-up clinic and say, test me for coronavirus, that's not being done. All testing really does require a screening process and then an appointment so that you don't end up going to an emergency room where you might get exposed to something more serious if all you have is a simple cold. So again, you may not even be offered testing if your risk stratification screening really doesn't indicate it. You may be directed to perform self-monitoring, or you may be directed to visit a respiratory illness clinic where we would do some additional screening. Or if you were really sick, like Dr. Levine said, you'd go to the emergency room.
Dr. Russell, could you continue and say a little bit more about if someone thinks they have symptoms, what should they do to self-monitor while at home, and what would a home health care agency do about monitoring people at home?
Absolutely. So these are really important questions. One of the things is anytime someone's coming into your home to provide direct care and they don't live with you, you should really be making sure that they are wearing a mask, because any one of us could be an asymptomatic carrier. And so this is a way to reduce risk of transmission. If people are worried that they may be developing the symptoms of COVID, it's important to connect with your healthcare provider so that we can have you on our monitoring system so we know to check in with you at set intervals. And also so that we can alert any of your in-home caregivers. Excuse me. Some people have asked about oxygen level and should I check my temperature? Right. So generally speaking, if you're asymptomatic, no. But if you do get diagnosed with coronavirus or you feel you are at risk, you may be asked by your provider to check your temperature at set intervals during the day. Similarly, we're not recommending that everyone go out and buy an oxygen pulse monitor, a finger monitor, but what we do know is that sometimes when people develop shortness of breath and their oxygen level drops, that can be a sign that they need to get to the hospital much sooner rather than later. So again, people were asking, well, what's the absolute value that I should be calling my doctor to let them know that my oxygen is dropping? And the answer depends on people's baseline oxygen level. But in short, I would leave it to the discussion between the patient and the doctor. Mainly, if you're having shortness of breath symptoms, that's obviously a warning sign. Your healthcare providers who are coming into the house, basically, if you have symptoms of COVID, either confirmed or suspected, anytime someone comes into your house, you should be wearing a mask along with other members of your family. And healthcare workers should be doing what's called contact plus droplet precautions, which include eye protection, gown, gloves, and surgical mask. So we'll look like Martians when we're coming into your house, but that's to keep you and other patients safe. How is an exposed but asymptomatic patient managed by home health services? They're masked, the family is masked if they need to be present in the same room, and everyone on the team will provide full precautions. Family members are going to be asked to stay 6 feet away from healthcare providers and also limit the number of people in the room so that we can reduce the risk of exposures.
Okay, I'm going to ask you a couple more questions, Dr. Russell, that came in before today's call. One that I think is important, if someone knows they have the coronavirus and they want to get comfort care at home, how would they go about doing that?
This is another great question. So we have patients who, for many reasons, may decide, I don't want to go to the hospital at baseline, and especially if I have coronavirus, because I don't want to have escalation of care. I want to have a focus of comfort care. So we, as the primary care team and as part of Mass General, are able to do liaison work with our home care services, including hospice, mobile medical at home, and visiting nurse agencies, as well as vendors of things like oxygen. So we have the ability, most certainly, to provide comfort care in home through a coordinated effort.
Thank you. One last area for you to cover, and that is in the event that someone does have to go to the hospital or wants to be in the hospital and their level of illness requires it. Can you say a little bit about how the hospital policies have changed?
Yes. So I think one of the things that came up, I saw several questions about this, was around visitation. And it's, really, it's a very distressing time for all of us in healthcare. And certainly if someone, our loved one, goes into the hospital and I'm told, oh, why can't I go in? It warrants some explanation. So because this is a very highly contagious virus, we are restricting visitors from the hospital except under extreme circumstances, including end-of-life considerations. So the general protocol is that if we have a patient who requires hospitalization, any visitors would need to clear their visit with the site of care to make sure that they're allowed in. We do not yet have a policy whereby patients can be accompanied by, patients with memory impairments such as dementia can be accompanied by a family member, especially if they have the coronavirus. But we are aware of how distressing that can be for many of our families as well as for the patient. And every effort is being made by our inpatient teams to ensure that there is regular communication with the healthcare proxy at home, preferably video communication so the patient can see the face and features of their family, and that we're able to provide compassionate bedside care for people with behavioral challenges, especially in the setting of an acute illness.
Dr. Russell, can you also say a little bit about the new guidelines that have come out about ventilator usage? And there's a whole committee that has been working on this.
Yeah, so this is one thing that's people are worried about, generally speaking, in this pandemic is not how will we deal with people who have this disease, but how will we deal with the sheer numbers at one time of people with this disease. And the whole goal has been to, quote, flatten the curve, meaning have fewer people come down with this illness over a longer period of time so we do not overwhelm the healthcare system. At present, we are not at capacity, and patients who are requiring ventilatory support are being offered it. That being said, if we experience a surge in cases, what would happen at that point if the number of patients outstripped the number of ventilators available? There has been a national to local discussion about this, and Mass General, along with several other academic institutions in the city, have vetted their policies through the Department of Public Health to ensure that these are fair, non-biased modalities of offering care to patients in the event that we became sort of a crisis care delivery mode. But again, just to reassure, we are not at that point, and we are able to provide ventilatory support.
Thank you. I'm going to go now to Dr. Ritchie. We got many, many questions about prevention, and you covered much of this in your presentation, but I think it would be helpful to say a little bit more about questions like, should I have separate clothes if I go outside or I go to the grocery store, or I'm in areas where I may be around other people? How safe is it to eat food delivered from restaurants? And if it's possible to contract the virus from our pets?
Those are great questions. So let's start first with the question around clothing. And at this point, there are not specific recommendations stating that one should change clothes after going outside. That being said, if you were in some situation where you were unfortunately in close contact with a lot of other people, and you felt like your clothes were touching a lot of other things, it's not unreasonable to put them through the laundry, and that's really what's being recommended at this time, is to have your clothes changed and to put them through the laundry. Now, a second question has to do with food. It is clear that there are that coronavirus is able to stay alive on different kinds of surfaces, shiny surfaces for longer than surfaces that are not shiny for some reason. And so it is important when you go to the grocery store that you be aware of that and make sure that you have a mechanism to clean off with disinfectant your groceries before putting them away. Again, because as Dr. Levine stated, it's really you're touching those surfaces and then touching your face. That's really the problem. So generally we recommend that if you're going to the grocery store, that you find a clean area and a dirty area. You put your groceries in the dirty area and then wash your hands and make sure you have a disinfectant and clean each of those items off and put it over in the clean area. And that's what we recommend for groceries. And that's mainly, again, because the surface, it's really the concern about the surface. It is not a concern about the food itself. That gets to the second question around food, which is what to do with, takeout food. And in those instances, what we would recommend is, again, the surface of the box that comes in is worth cleaning with some kind of disinfectant, but not the food itself. The food itself should be fine, and you can, restaurants are working very carefully now to follow the highest standards around hygiene for the same reasons that all of us are trying to follow those standards. The last question has to do with pets. And at this point, there is no data suggesting that we can get or give coronavirus to our pets, which is a huge relief. And that's, as best we know, we don't have to worry about our pets at this time.
Is it safe to touch the mail?
So that's also a very good question. And again, what many people are doing, although this has not come through specific recommendations from the Center for Disease Control, is treating your mail like you would your grocery, which is when it comes in, either letting it sit there for a day or two so that essentially anything that's on it has essentially died off, or wiping it down before opening it. And then remember, wash your hands before you start this procedure and after you start this procedure. It's making all of us like surgeons. We're having to pay attention to washing our hands all the time.
Thank you.
Just have a follow-up that I see. You should not be putting any toxic chemicals on your food. So generally speaking, for things like fresh produce, it is the flow of water and the scrubbing that matters more. Don't try and use any chemicals such as bleach or soap, as that will just potentially harm you, or at the very least taste icky.
Thank you, Dr. Russell, for mentioning that. Yes, we're only talking about food items that have some sort of plastic on them or some sort of surface on them. But if they're fresh produce, then the most important thing is just washing them down with water.
The next question, I'm not sure who is best to answer it, so whoever wants to jump in. But the question is about, are there any medications that we can take to prevent coronavirus, such as chloroquine, Plaquenil, etc.?
I'm happy to field it.
Go ahead.
So I actually have had several conversations with our infectious disease specialists. And the short answer is we don't have any definitive data that suggests that there is any medicine that one would take right now as an outpatient for pre-exposure prophylaxis or post-exposure prophylaxis. That being said, studies are actually underway to explore this. So the unsatisfying answer is that it is too soon to tell. We do not have the data. Many of the medications that you are hearing spoken about in the lay media are actually not that safe to just sort of take willy-nilly. They do have their own side effects, and they are often medications used by people with other underlying diseases. So we don't recommend creating a shortage of that medicine by overuse that isn't exactly evidence-based.
Thank you.
I want to add just one thing to that, and that is that as Dr. Russell noted, there are clinical trials underway. It is quite possible that we will become a site for some of those clinical trials. And if that is the case, and there are trials that allow us to see whether or not there's a way to reduce the likelihood of getting the virus by taking a medicine, we will let you know.
Thank you. We also just have a comment from someone that I want to make sure that we share, and that is that anyone with a concern about a COVID patient with dementia and caregiver stress, you can always call the Alzheimer's Association, which has a 24/7 helpline. And the number is 800-272-3900. We also have gotten some questions that I think are pretty challenging for all of us to answer now, but I don't want to ignore them. And so one is, how much longer do you think we will be in this surge environment of the virus peaking? And how long, is there any crystal ball that might tell us how long will we be getting care via telemedicine or remotely, knowing that a vaccine is not going to be delivered overnight?
Can I interrupt for 1 minute, Susan? On the dementia question, if you are a caregiver or living with someone who has dementia or care for your mom or dad, etc., we're going to be having, through the Dementia Care Collaborative, which is a program from Mass General Hospital, we provide education, exercise virtually through the Ageless Grace program, and many other educational and teaching opportunities. We also provide one-on-one talking with people and working with them through the MDU clinic. So we'll put up the phone number and the email, if Nori would do that, for the Dementia Care Collaborative. We're also going to have a town hall like this for people who have that specific concern. Sorry, Susan.
No, that's wonderful. Thank you. Thank you. So we only have a few minutes left. So I'd like to maybe go back to that question. And then I think we also really want to hear from people about any other topics that you would like to see addressed in future town halls like this before we close.
So I just can appreciate, and we're all asking that same question from this end as well. How long is this going on? We went into this business because we like being with people and we like helping people. So it's a very strange new world for all of us. The short answer is that because we are attempting to flatten the curve, that means that there will be a longer period of social distancing to prevent mass amounts of people from getting this virus. So at present, my understanding is we are looking at least until the end of May. When last I looked at that from the state, and how and when we relax the social distancing will depend on what's probably going on right now on the other side of the world as they are relaxing their social distancing. So it is an area where we don't have a hard and fast answer, but we are very, very hesitant at this point to relax things.
Thank you. Any last comments from any of our speakers today? Any words of wisdom that you want to make sure that people remember as we're getting close to the end of our time? Dr. Levine?
I think it's very important, if you have people in your lives, to talk about, I want to reiterate what Christine Ritchie was talking about, to talk to people about what you want and to make those connections. You know, we have patients who are not the patient. They're the caregiver. And sometimes I say to them, you know, what happens if you get sick? What plan do you have? What plan do you have for someone to come in and do stuff and to go shopping and to do all the things that you do for your spouse if you can't do those things? And I think it's hard to think about those things. I think it's really hard to think about those things, but I think it's necessary because it's good to have a plan, because when this happens, it's been happening very quickly. The people who get sick, they're maybe okay for a few days, and the ones who get really sick and need to, you know, are sort of out of commission, whether they're hospitalized or not, is profound. And not everybody has a zillion friends around, and not everybody lives in a place where there's services where they can be taken care of. So I think it's good to have a plan. You know, pray it doesn't happen, but be prepared if it does, because we don't want to be caught off guard. Have, this is where I keep my this is where I keep my this is where I keep my this. Tax season may be delayed, but it's gonna come. And to be thinking towards the future. This will be over, but it's a good way to think about life anyway when you get at any age, really, but especially as we get older, to make plans for what we want our futures to look like and what we want together with the people who are important to us or live with us. And I didn't want to leave that out of the equation just because we're in coronavirus land now, that we don't think about those things all the time. But this is a good opportunity that we shouldn't miss.
Thank you. I think people were entertained by your comment about taxes will never go away. So, Dr. Ricci, anything you'd like to leave as the last thought?
Well, actually, one of our participants put this on chat, and I think it's a wonderful, potentially parting set of words, which is obey the rules. And I think in this instance, this means keep your distance, wash your hands, wash your hands, wash your hands, wear a mask when you go outside, and if we all do our part, we're doing that for ourselves, we're doing it for all of those around us, and it's a way to really build and be community to each other in this very difficult time.
Thank you. Ms. Sterling Graves, any last words of wisdom? Emily?
Oh, hello. Just that we're here for you, and we're all in this together. I mean, I think we see it posted on tops of banks and, as we're, everywhere, but it really is, it is something. So, and if there's something that you have more questions about and you're not sure how to handle it, to please give us a call.
Dr. Russell, I think you get the final word.
Muted, now I'm unmuted. Can you hear me now?
Yes.
All right. So just to echo what Ms. Sterling Graves said, it is really important that you understand that your care goes on even in the midst of a pandemic. We're available. We are working 24/7. There is somebody able to take your call, whether it's about COVID, whether it's about a bellyache or any other symptoms of the myriad symptoms we can all experience. So please do not hesitate to reach out to us, and we'll be able to manage you in home. And it's great to see your face. So if you can, encourage your friends and family who are part of our practice to become tech savvy enough so we can do these visits, either in a one-on-one medical visit or as part of the Zoom patient outreach. I think that's a really good thing because even when all this is over, you may not want to schlep into Mass General, deal with the traffic. If this is something that we could have a conversation while you're sitting in your living room to keep you safe and sound and answer a question. So stay well, wash your hands, and know that we are here. And thank you all so much for your time and taking time out of your day to do this.
I'm going to close out now with just a quick phrase from one of my favorite poems from one of our beloved New England poets, Mary Oliver. And it's from a poet called Don't Hesitate. And she encourages all of us to experience as much joy as we possibly can now. And the last line of the poem is, don't let joy be a crumb. So with that, I hope you all have a wonderful rest of your day. We look forward to hearing more topics that you would like to see us feature on town halls like this in the future. And I hope everybody does follow the rules and stay healthy and enjoy yourselves. Take care.